Welcome everybody, with you Dr. Magdy Abdel, consultant of infectious diseases, hepatology, and gastroenterology. Our topic today about syphilis. Syphilis is a sexually transmitted infection that causes sores and a skin rash. It can be life-threatening without treatment. It spreads when you have vaginal, anal, or oral sex with someone who has the infection. A bacteria causes it. Antibiotic medications treat syphilis. Untreated syphilis can lead to serious health problems, including blindness and damage to your brain, heart, eyes, and nervous system. So, what are the stages of syphilis? Syphilis can progress through four different stages. The infection causes different symptoms in each stage. People are very contagious in the first and the second stages and can easily pass the infection to their sex partners. The stages of syphilis are primary, secondary, latent, and late tertiary syphilis. Primary syphilis, this is the first stage, happens 2 to 12 weeks after exposure to someone with syphilis. During this stage, a smooth, hard sore called chancre develops on your genitals or mouth. A chancre is small and usually painless, so you may not even know it is there. The sore goes away on its own in a few weeks or months. However, this does not mean you do not have syphilis anymore. If you do not receive treatment with medication, the infection moves to the second stage. You can pass syphilis through vaginal, anal, or oral sex during this stage. Secondary syphilis, about 1 to 6 months after the syphilis sore goes away. A rough, bumpy syphilis rash appears. The rash can cover your entire body, including your palms, soles of your feet. The rash does not usually itch. You may also have symptoms such as fever, fatigue, wart-like sores, muscle aches, weight loss, headaches, hair loss, swollen lymph nodes. You can pass syphilis infection during this stage, during vaginal, anal, or oral sex. These symptoms can come and go for months or years just because the syphilis rash is gone or you are not having any of the above symptoms. Does not mean you no longer have the infection. You still need treatment with medication. Without treatment, the infection will move to the latent stage. Latent syphilis, if you do not receive treatment during the first two stages, the infection moves into the latent stage. In this stage, there are no outward signs or symptoms of syphilis. Some people experience mild flare ups from time to time. At this stage, the infection can damage your heart, bones, nerves, and organs. This stage can last up to 20 years. It is rare to pass syphilis to your sex partner during the latent stage. Without treatment, the infection progresses to the late stage. Late tertiary syphilis, for many people, symptoms do not progress past the latent phase either because the infection cures itself or because symptoms are too mild to notice. About 20% of people progress to the late syphilis phase, which causes range of serious health problems. These problems occur slowly and include brain damage, dementia, and cognitive health problems, heart disease, movement disorders, and muscles problems, nerve damage, seizures, vision problems, including blindness. So, There is also problem considered as regard the pregnant female. This may lead to congenital syphilis. Congenital syphilis occurs when pregnant person passes the infection to the fetus during pregnancy. Syphilis causes severe health problems, including death in babies and young children. Your pregnancy care provider should screen you for sex transmitted infections at one of your first prenatal visits. It is important to receive treatment right away if you have syphilis. So, how common is syphilis? So, as regard syphilis, it is spreading nowadays too much. So, the infection is more common in men and people assigned male at birth. Men who have sex with men are diagnosed with syphilis more than any other group. Who might get syphilis? Anyone who is sexually active can get syphilis, but your risk is higher if you have unprotected sex, especially if you have several partners. Or a man who has sex with men have HIV also have had sex with someone who is tested positive for syphilis, tested positive for another sex transmitted infection such as chlamydia, gonorrhea, or herpes. All these may increase the rate of syphilis infection. So, what are the symptoms of syphilis? Syphilis symptoms vary depending on the stage of the infection. So, you are most contagious in the early of the early stage of infection. You are most contagious when you are most likely to notice symptoms. During the first stage, one or more sores develop on your genitals. You may not notice them or mistake them for a pimple or other skin lesion. During the second stage, you may get a rash and experience flu-like symptoms such as fatigue, fever, sore throat, and muscles aches. After the second stage, the symptoms of syphilis are hidden, latent stage. Just because you do not have symptoms does not mean the infection is gone. The only thing that cures the infection and prevents it from progressing is treatment with medications. So, what does syphilis look like? In the first stage of syphilis, a small, smooth sore develops on your genitals, mouth, or lips. It may resemble pimples and be so small and harmless that you do not even notice. This sore goes away on its own in about 6 weeks. Thank you very much.